I want to acknowledge with respect the Indigenous peoples and communities whose historical relationships with the land continue to this day and on whose traditional territories all of our work takes place. My name is Autumn Sipus. I am the project coordinator with the Canadian Coalition for Green Healthcare. And on behalf of the coalition, I would like to welcome you to today's webinar, Advancing Awareness and Adoption of BPMM in Healthcare. Throughout the webinar, please use the chat function for any technical issues you may be experiencing and use the Q&A for any questions you may have throughout the webinar. I will be answering questions at the end of the presentation today. This webinar is also being recorded, and the recording will be sent out to all registrants along with the webinar slides at a later time and will be also shared to our website and YouTube channel. So, for those of you who don't know, the Canadian Coalition for Green Healthcare is Canada's premier green healthcare resource network and is helping lead the evolution of sustainability in Canada's healthcare sector as a national voice and catalyst for environmental change. Collaboratively, we strive to reduce healthcare's ecological impact from compassionate care delivery while providing a platform on which to discuss and promote best practices, innovation, environmental responsibility, and climate change resiliency. Okay. So our agenda today, to start with, we're going to just have a little background of the project, a bit of an introduction to the topic of battery-powered micromobility, and then we're going to get into some insights from some of our project work, including user profiles, a national survey we conducted, our case study, and we're also going to provide some general recommendations for individuals and for organizations in terms of adopting and supporting battery-powered micromobility. So, about the project. This webinar is part of a project the Coalition started in March 2023, a zero-emission vehicle awareness initiative with funding from Natural Resources Canada. The objective of this project has been to increase public and industry awareness, knowledge, and confidence in zero-emission vehicles, particularly battery-powered micromobility solutions, as well as accelerate the adoption of these solutions by targeting the health and social services sector. More specifically, our project aimed to research the adoption of battery-powered micromobility solutions and related infrastructure in the health services sector, increase awareness of these devices, increase the number of and access to BPMM education documents specific to the sector, seeking out and engaging micromobility champions and thought leaders, engaging and educating senior healthcare leaders, and just overall encouraging the adoption of clean transportation methods. So our project activities have included the creation of fact sheets, user profiles, case studies, an environmental scan, the national survey, battery-powered micromobility champion slide deck, and an educational video, along with webinars such as this. This project could not have been completed without the technical knowledge and practical insights of our various collaborators, who you can see on the screen. Big thank you to the Canadian Electric Bike Association, Synergy Santé Environment, Canadian Federation of Nurses Unions, the Canadian Automotive Museum, the VCT Group, Sunnybrook Health Sciences Centre, Blackstone Energy Services, the Canadian Association of Physicians for the Environment, Velocity, Cycling Without Age Canada, DCL Healthcare Property Inc., and eBike Bros. So now a little background. To get us started, what is battery-powered micromobility? BPMM references small, low-speed, lightweight vehicles powered by a battery, usually traveling at speeds below 32 kilometers per hour. Devices can either be fully motorized or motor-assisted, where the device still requires some human propulsion by either pedaling or kicking. BPMM devices include things like electric bikes, which you can see on the right side of the screen, cargo e-bikes, electric scooters, and battery-assisted trishaws. There also are some other types that could be considered battery-powered micromobility, but these were the primary focus of the work that we did throughout the project. So why battery-powered micromobility in healthcare? The transportation of patient, staff's goods, and services are vital to daily operations of Canadian hospitals. Since there is an inextricable link between health and the environment, healthcare has a significant role to play in shaping sustainable cities and clean commuting options. While ZEVs are an important alternative, especially for the future transportation of goods and services, battery powered micromobility and other forms of micromobility can act as an even more effective, efficient, and clean alternative for those commuting to and from healthcare facilities. It is also actually a great option for last mile delivery of goods and services. So think about even the transportation of small items across healthcare campuses, such as medications. So we all know transportation is one of the largest sources of GHG emissions in Canada. In 2021, transportation accounted for 22% of total national emissions, and passenger vehicle transportation, cars, light trucks, public transportation, etc., accounted for 57% of those total emissions. So, with over 2.6 million people being employed by the Canadian healthcare and social services sector in 2022, supporting and promoting a clean commute in the sector thus presents or thus has the potential to significantly decrease transportation-related GHG emissions. Even further, the Canadian healthcare sector also has the potential to provide community leadership in the adoption of technologies and practices which will improve planetary health. As one of the most trusted professions, healthcare workers are important influencers on societal issues and have an important part to play in the transition to a sustainable, fair, resilient, and healthier world. Healthcare organizations themselves are also essential institutions within their communities and have an opportunity to lead by example in terms of supporting infrastructure for battery powered micromobility as well as zero emission vehicles. My hope is the following presentation, which shares insights gathered over the course of our project, will present a compelling case for the adoption of battery-powered micromobility and the implementation of supportive infrastructure at healthcare facilities. So to start us off, I want to talk a little bit about our user profiles. So as part of the project, we conducted interviews with 4 healthcare workers who use electric bikes or e-bikes on their daily commutes. So a big thank you to Colin Chan, Regional Leader of Sustainable Clinical Services at Vancouver Coastal Health, Catherine Payne, Pharmacy Operations Supervisor at Ontario Woodstock Hospital, Mike Apostle, Energy Management Specialist at London Health Sciences Centre, and Stéphane Menard, Mental Health Worker at the Institut National de Psychiatrie Légale Philippe Pinel in Montreal. So there were some common narratives which came out of these user profiles, which included various benefits and drawbacks, such as the benefit of a less exertive commute. Multiple participants mentioned not needing to change or shower when getting to work like they might with a regular bike. I think the use of the assistants, helping on the road to work really does uh, make things more calm, more enjoyable, that type of thing. They also mentioned the convenience as another important benefit. So when they're feeling low energy, it's just a really great option. It helps them get to work faster and more efficiently, which also relates to the benefit of being able to avoid traffic. Mike Apostle in particular says he appreciates the consistency of his commute time, particularly on days when he needs to pick up his children from school and preschool. From experience, Apostle knows that with an e-bike, you can simply cycle around the road traffic in the afternoon with everyone leaving the hospital at the same time. This is London Health Sciences Centre too, so it's not a small hospital. It can easily take him more than 10 minutes just to get out of the parking lot. So it's nice for him to be able to have that consistency, especially when he has certain commitments that he needs to get to after work. E-biking also provided our participants with an enjoyable commute. They mentioned how their e-bikes allow them to get outside and enjoy the fresh air, riding through parks and quiet neighborhoods as being much more enjoyable than sitting in a car. Catherine Payne said her micromobility commute helps her to decompress after a long day or long and stressful day in her department. Cost effectiveness was another benefit, with participants being able to avoid the cost of gas, transit fees, and potential parking fees as well. In terms of physical health, interviewees acknowledged the potential for getting exercise in spite of the battery assistance. Catherine Payne, in particular, said that she can still get the benefits of exercise by determining how much battery assistance she uses while riding. This is especially important feature of e-bikes for people like Payne who have health and mobility issues. She says that if she's having a flare-up of arthritis or a particularly just bad day, that's the time for her to ramp up the insistence. Or when she's having a good day and she wants to work out, she can easily lower the assistant level and put in the work. We also can't forget about the benefit of quality time with family. As you can see, we had 2 participants who enjoy taking their young children for rides on the e-bike. So now getting into drawbacks. Some common drawbacks which came out of the user profiles included the weight of the device. Unfortunately, BPM devices, particularly e-bikes, can be quite heavy, making them difficult to maneuver and transport if needed. All interviewees also expressed a fear of theft. So the average cost of an e-bike is approximately $1,000, making theft a serious concern for users. I know regular micromobility users feel this as well. These devices are often not cheap. You want to invest money in a good one, but you want to make sure that it's going to be safe and protected when you're using it for commutes and even, running errands and that type of thing. This is one reason why proper infrastructure like secure storage is very essential for the support of battery-powered micromobility. Weather dependence was also a concern. As you all know, we live in a country with lots of snow and rain and ice in the winter months, making micromobility a less than ideal option for winter commutes. But one of our participants, Stefan Menard, actually only rides his e-bike during the winter. He attributes his success to well-maintained bike paths in Montreal, taking proper care of his device, and being able to complete maintenance tasks himself. So it definitely is possible in spite of our cold, disgusting winters. There was also a concern expressed over charging. So a few users mentioned they have run out of juice on their way home before. I know all of us have forgotten to charge our phone at some point in time before going out. And I think similar situations can happen with the bike. So one person actually had to push their bike for a good distance, but another is actually able to still pedal without the assistance, just a little more of a struggle. So it really depends on the weight of the device. So charging areas at places of work could really help alleviate these concerns. Finally, interviewees also mentioned a lack of e-bike specific mechanics and technicians. So we presented a webinar with the Canadian Electric Bike Association last month, and that's one of their missions, is to really improve the number of e-bike specific technicians across Canada, because there is a lack of them. So some participants have to travel quite a distance in order to have their bike serviced. So hopefully we'll start to see an increase in technicians in the future. Some additional insights included hopes for the future. So user profile participants wanted to see additional city infrastructure to support micromobility, including implementation of bike lanes so riders can avoid vehicles and heavy traffic, the implementation of proper parking and storage for BPM devices, meaning they're easily accessible, secure, temperature controlled, etc. More affordable BPMM options and rebate availability, and an increased number of technicians with e-bikes expertise. So, also as part of our project, Coalition developed or deployed a survey from May to October 2023 to better understand the knowledge level and usage characteristics of BPMM users among healthcare personnel. The survey was open to all Canadian healthcare personnel, not just those that use BPMM devices. We received 157 respondents from healthcare workers across Canada. Of those 157 respondents, 50% lived in Ontario and 33% lived in Quebec. We attribute this to the high number of coalition stakeholder contacts in Ontario and the exceptional work done by our partner, Synergy Santé Environment, to solicit responses in Quebec. We received responses from a very diverse age range of participants, the most common age range being 46 to 55 at 30%, followed closely by 36 to 45, 27%, and 26 to 35, 20%. So it was great to see a good diversity of participants. The most common workplace of survey respondents was hospitals at 64%, but the professions of those working in hospitals varied significantly. We had survey responses submitted by nurses, medical students, pharmacists, physicians, physiotherapists, CEOs, environmental coordinators, laboratory technologists, and more. In order to assess the knowledge of survey respondents on the topic of BPMM, we asked respondents to rate their level of understanding of BPMM solutions. Very few claimed to be experts, only 6%, but 55% of respondents claimed they were either a novice or had at least some knowledge of battery-powered micromobility. In terms of ownership, 24% said that they owned a BPMM device, with 16% claiming to own an e-bike and 8% owning an e-scooter. Of the respondents that own a BPMM device, 46% use their device to get to and from work, and 40% use their device for leisure purposes. Other purposes included to run errands and use as part of their job. Survey respondents were also asked to submit perceived benefits and drawbacks of owning a battery-powered micromobility device. The most common perceived benefits included environmental and cost saving when compared to owning a car. Many mentioned the potential savings, including no need to pay for parking, gas, and insurance. Two other common benefits included health positivity and ease of travel or commute, particularly for the elderly and those with health or mobility limitations. The other benefits that were mentioned included perceived quietness of the devices, encouragement of, in general, non-car infrastructure, and the ease of learning to use. The most common perceived drawback was safety and the potential for injury to riders and pedestrians. Safety concerns included lack of helmet use and training, people not abiding by rules and regulations, so riding on sidewalks, and fear of encounters with car due to the absence of bike lanes. Lack of infrastructure, such as bike lane storage and charging options, was also the most common drawback at 19%, followed by the initial cost of the devices and cost of repairs. To gather information on the presence and use of BPMM rental services by healthcare workers, we asked respondents whether there were rental services available in their cities. 41% of respondents were unsure whether they were available, and 39.5% confirmed yes, there were rental services available. We also asked respondents whether there were rentals near their place of work. Only 18% responded yes, and 45% of respondents were unsure. Of those that said they were unsure or that there's no BPM rental services near their place of work, the survey asked how likely they would be to rent if the rentals were available to them. The majority said they were very unlikely, fortunately, but 25% did say they were either somewhat likely or very likely to use rentals if they were near their place of work. So of the 157 respondents, only 22% claimed to have ever rented a device. The most common purpose for renting was for leisure, which was 71%. And of those who have rented a BPMM device, the majority have done so less than 5 times a year, and only one person claimed to rent them weekly. As for So the survey also asked respondents to submit their perceived benefits and drawbacks of rental services. The most common perceived benefits included convenience at 19%, cost effectiveness at 17%. Sorry, I just realized this is the wrong slide. Okay, so um, of those who have never rented a BPMM device, the most common reasons were that they found no need to. They either drive, bike, or walk. They also found that devices were not available close by or convenient for them, or they already owned a BPMN device. So now back to the benefits. So the most common benefits shared about rental services was not having to worry about the maintenance, storage, and charging of devices because someone else takes care of that. Um, they also mentioned the convenience of these devices, just being able to pick them up and go. Also, there was a perceived cost effectiveness. And a lot said, it's great to be able to use the rentals to test out these devices before a potential purpose or before a potential purchase. So, as for perceived disadvantages, the majority of respondents were really concerned about the cost and perceived lack of availability when needed. Safety was also on the disadvantage list, with some respondents concerned about the lack of supporting infrastructure, such as bike lanes, low knowledge of rules and regulations, and fears over users not wearing safety gear, such as helmets. Others mentioned disadvantages were needing a phone to rent, concerned over manufacturing and recycling of batteries, and weather. Similar to the user profiles, we found various common themes throughout the survey. Whether respondents had or had never ridden BPMM devices, there was common concerns over safety. Non-riders had concerns over people riding on sidewalks and the lack of helmet use. Non-riders and riders alike hope to see more micromobility supporting infrastructure such as bike lanes in order to keep riders safe from traffic. There was also an acknowledgement of an environmental benefit to BPMM devices throughout the survey and health and environmental co-benefits. Respondents mentioned the potential for reduced emissions and the resulting benefit to air quality and therefore human health. There was also an acknowledgement of general health benefits. So respondents' thoughts were consistent with those of the user profile participants, and that BPMM usage can result in improved mental health, reduced stress, and increased physical activity from the low impact exercise, which is, again, particularly great for elderly and those with mobility issues. Another common concern was cost and the general lack of infrastructure. Just wanted to point out, additional support from federal, provincial, municipal bodies in the form of rebates, incentives, and other funding opportunities could drastically improve the perception and uptake of these devices, which is clear just through the amount of people that pointed to, again, lack of infrastructure and concerns over costs. So we have various recommendations for individuals. We recommend that all healthcare workers weigh their options for a sustainable commute, ask themselves what would work best for their lifestyle and budget. If it would fit their needs and they're interested in battery-powered micromobility, make sure to educate yourselves on the different types of devices, the safety considerations, the rules and regulations in your city, and the possible rebates and incentives available to you. We also recommend that people test drive before they buy in order to help them get comfortable and decide what type of device might be best. You can check out our website for resources and other recommendations. There's a wealth of information in our fact sheets as well as our user profiles. It would also be beneficial to know what infrastructure is available to you at your place of work. Is there secure storage areas for micromobility? Are they easily accessible? Is there charging availability? That kind of thing. And whether you plan to be a BPMM user or not, one way you can help support the move to clean transportation is to advocate for infrastructure at your healthcare organization and in your community. You can do this by sharing our collateral, using our resources, and pointing people to our website. So I just want to move on to the facility side of things now. Our team interviewed 4 different healthcare facility representatives to develop 3 case studies, which present different opportunities for BPMM integration and advocacy in healthcare. For our first case study, we interviewed Joel Drennan, a registered nurse with the Yukon Home Care Program in Whitehorse. The Yukon Home Care Program provides a multitude of territory-wide services such as care coordination, home support, occupational therapy, physiotherapy, social work, and nursing. Service delivery in Whitehorse is made possible in part thanks to 2 battery-powered micromobility devices, otherwise known as e-bikes, and affectionately called Speedy, Tweety, and Sylvester. You can see Tweety in the bottom photo on the right side there. Our second case study told the story of Hillside Pines Home for Special Care, a long-term care home located in the beautiful Nova Scotia town of Bridgewater, which aims to treat loneliness, helplessness, and boredom while providing compassionate medical treatment. One way Hillside Pines delivers on this commitment is through the use of 3-wheeled battery-powered micromobility bicycles known as trishaws, where they can take their elderly residents out for rides. So you can see that in the top photo there. Oh, I also wanted to mention that we did a webinar with these 2 case study participants back in January. And so if you want to learn more about those, you can also watch the webinar recording on our YouTube channel. So our third and final case study looked at 2 different healthcare facilities in Quebec. The first was Centre Intégré de Santé et de Services Sociaux de Oulatois, which offered interested employees the opportunity to test out e-bikes free of charge for a period of a few hours up to several weeks. The second story in this case study profiled the Institut National de Psychiatrie Légale Philippe Pinel and their actions to understand staff community needs through surveys, which ultimately led to the implementation of secure storage areas for micromobility devices. So you can see in the bottom photo, those are the test drivers at CIFS, and the top image is a secure storage area that was implemented at the Institute. So there were certain themes that we noticed during our interviews with case study participants, which aligned with those from the user profiles and the survey. One being mental health benefits. Joel Drennan from the Yukon Home Care Program said that halfway through the pandemic, there was a lot of burnout and mental and physical stress for colleagues and staff in general. So their organization started looking at ways to promote both mental and physical health, which included looking at government goals, one of which was fleet diversification. Joel in particular says that riding the e-bike, especially in the area of COVID recovery, has helped him to maintain positive mental health, increase productivity, and a stronger commitment to remain working for the Yukon Home Care Program. Similarly, pilots of the trishaws at Hillside said the trishaw rides help them to recover from burnout and connect with the elders they care for. These pilots have also noticed positive changes in the mental health of the elderly riders, including reduced what they call reactive behavior, as well as improved memory. Case study participants also mentioned their sadness of having to shut down their programs during the winter months. At CISSS in Montreal, e-bikes deployed in their test driving project were 3-season bikes that could not be used in the winter because they were deemed not strong enough to support the extensive damages associated with winter use. So with the Hillside Pines program, it's really not possible for them to go out in the winter, not just because of their advice, but also the sensitivity of the elderly riders. On the positive side, the Yukon Home Care Program hopes to purchase additional equipment, such as winter tires, to allow them to continue using their bikes in the winter months. Every project also put an emphasis on safety. For the Yukon Home Care Program staff, they are only allowed to ride once they have completed the appropriate education sessions, which include physical and theory training. Daytime use by the staff there is typical, but after dark travel is only permitted, providing proper safety precautions are exercised. including using front and rear lights, together with wearing a helmet and high visibility clothing. They also use a simple e-bike sign-out sheet, which reminds users to perform the safety checklist. So making sure that the tires and brakes, everything looks good, looking at the charge status and the presence of the lock and helmet. At Hillside, all TriStar pilots are fully trained, and equipment such as helmets are required by both riders and pilots. The program managers have also developed an emergency plan, which highlights what to do in different situations while on a ride. There was also a lot of talk around infrastructure. So the Institute in Montreal, through their survey, found that what was really lacking was secure parking that could reduce incidents of theft. So with the cost of micromobility devices, their employees really did not feel that they could leave their devices in the original parking lots unprotected. So the Institute, took initiative and decided to help support their employees by implementing secure infrastructure. So finally, some of these programs would really have not been possible without government funding, rebates, and incentives. The Yukon Home Care Program was able to access a rebate in the Yukon specifically for battery-powered micromobility. And they also got an additional discount from territorial health funding. Hillside Pines was also able to access funding from the Nova Scotia government's Department of Health and Wellness to cover the cost of their 2 trishaws and the program management. So these government programs were really essential, basically, to the development of these programs. So, just some recommendations for healthcare organizations and how they can support micromobility and battery-powered micromobility users. The most important way is by implementing proper infrastructure. Our infrastructure fact sheet provides a full guide to implementing this type of infrastructure, and there are various things that facilities need to consider, including security, accessibility, charging, ventilation, and fire safety. I don't know why my images are not working. It's making me sad. Well, that one works. So some other recommendations for healthcare organizations include creating opportunities for their employees to experience and familiarize themselves with BPMM commuting options, which can significantly encourage, the adoption of these devices. Some potential initiatives that could be implemented include a semi-annual guided commute between healthcare facilities, which is an excellent way to showcase existing infrastructure and engage potential users. Events like this could highlight safe commuting routes, including separate bike lanes and traffic calm streets. It serves as an educational and experiential opportunity for employees to learn about the most efficient and safe routes for BPMM commuting. A test riding day can also be really great. So partnering with a local cycling shop to arrange a day for test riding various BPMMs can be very effective. Such an event would allow employees to try out different types of e-bikes and e-scooters in a safe, controlled environment, potentially increasing their comfort and interest in those modes of transportation. And finally, the creation and dissemination of educational information packets and/or events is also a great way to advocate for clean commuting, whether it's just sharing infrastructure availability on campus, hosting talks on the benefits of zero-emission transportation, or even just sharing resources in your organization's newsletter are great ways just to provide awareness and put clean commuting in a positive light. So before we get to the Q&A, I just want to extend another big thank you to Natural Resources Canada, as well as our collaborators for their support, knowledge, and technical expertise. Without you all, this project would not have been possible. Okay. Now, if anyone has any questions, please add them to the Q&A. I'm happy to answer anything. You can also send me an email to autumn@greenhealthcare.ca if you have any further questions or if you want to get involved. As I said earlier, I am recording this webinar, so it will be shared with all registrants, and I will also be sharing this slide deck so you have access to the links and our resources. So Jay Higgins said earlier that the average cost of a safe e-bike is more in the $2,500 range. I think I said earlier it was around $1,000. We have a couple experts that recommended that it's the amount, but I know there is a very wide variety of different devices available on the market, and probably for a safe and good one that's going to last you a long time is most likely in the higher cost range, but the initial investment is still cheaper than, let's say, a new vehicle. I know one of our user profile participants, Mike Apostle, said that one of the reasons he likes riding his e-bike is because it saves him from using his very aged vehicle. So he doesn't have to purchase a new one yet. Okay, so it doesn't seem like there's any pressing questions. So I would like to thank you all for joining me today and sitting through my presentation. Like I said, please feel free to send me an email if you have any additional. Can you recommend a contact at Hamilton Health Sciences that we could reach out to arrange a test drive day? Definitely, Jane. Can you please shoot me an email and I can put you in contact with someone from Hamilton Health Sciences? I'm going to just put my email in the chat so you can copy it. And I would love to, yes, put you in touch with someone to arrange that. I was thinking that as well when you said that you own an e-bike shop. I'm like, test drive day. So again, thank you, everyone. I hope you enjoy the rest of your day. And again, I'll be sending out the recording, slides, all that good stuff. So thank you and take care.